Hello everyone. So in this video, I'm going to speak about the pelvic organ prolapse quantification system, and which is referred as POPQ. So usually we use this quantification system to assess the degree of prolapse and make a stage, like a staging of the vaginal wall or uterine descent, and also to communicate with our colleagues regarding the patient. So sometimes the GP may refer the patient for you because she has a prolapse, and then you need to reply to his letter that you have examined the patient and you find she has like that prolapse. So if you refer her back with a POPQ quantification system that may be more professional, is also when you refer the patient to a subspecialty doctor, like you are seeing the patient in the secondary care and you feel that this patient needs proper assessment from a urogynecologist. So when you refer the patient, also you can tell about the degree of prolapse with this system. Actually, many of us may struggle in identification of how we assess these points and where we can find them normally. So I'm going to explain it in a very simple way so that we can imagine what's going on inside. Okay, so it needs a little bit of drawing, so I will share with you my screen. And I will tell you that if we have the uterus, vagina, urinary bladder, urethra, and rectum, and everything in its normal position, we should have around 9 points or 8 points and total vaginal length. So we are going to speak about 8 points plus total vaginal length. Okay? Okay, so we have these points. 4 of them are actually inside the vagina. So inside the vagina, if that's the uterus and this is the vagina, as I told you, we have 4 points inside the vagina. So first of all, we need to know what is our reference. So our reference is the hymen. So if the hymen is at this level, we call it 0 level. Okay, so 0 level is the level of the hymen. So any prolapse or uterine descent or vaginal wall descent above the level of the hymen will be measured by minus. Like any point, we are going to discuss the points now. So any point which is below its normal position, or even if it is in the normal position, will be referred as a minus if it is above the hymen level. And anything below the hymen level will considered or referred as to be a positive distance. Okay, so that's how we we refer the points first. So let's see what are the 4 points inside the vagina. We have point A, point B, point C, and point D. I'm going to speak about each point separately, okay? So we'll start with point A and B. So we need to agree that point A and B are duplicated, like if I'm speaking about point A, which is placed on the anterior wall, I have identical one on the posterior vaginal wall. If I'm speaking about point B on the anterior vaginal wall, I have identical one in the posterior vaginal wall. And we tell like A sub A, that means this point A, which is located on the anterior vaginal wall. And when we tell B sub A, that we are speaking about point B, which is placed on the anterior vaginal wall. And when we speak about A sub B, that's point A, which is placed in the posterior vaginal wall. Sorry, should be P. Okay, and if we speak about B sub B, that's point B, which is in the posterior vaginal wall. But they are the same, like A anterior is the same as A posterior, B anterior is the same as B posterior. Okay? So what's point A and what's point B? So let's draw the vagina again. So that is the uterus, and here is the vagina. And our reference will be the hymen, which is at level 0. Okay, so if we go above the level of the hymen by 3 centimeter, like if this is 1 centimeter, 2 centimeter, 3 centimeter, 4 centimeter, 5 centimeter, and 6 centimeter. So if we go above the hymen level by 3 centimeter here, and the same at the posterior wall, we will find the point A. So here we will find point A anterior, and here we will find A posterior. So where normally we find A point, it's placed 3 centimeter proximal to the hymen. It's proximal to the hymen. 3 centimeter proximal to the hymen, or we can refer it as -3. So point A is normally located at -3, and it is a fixed place in the vaginal wall. So when the point A descends on its on its normal position, like if it is not in its normal position, when the vaginal wall start to descend, so this point A will be displaced from its normal position. So it can be -2 at the level of -2, it can be at the level of -1, it can be at the level of 0, or even it can cross the hymen and go in the positive side to its maximum range, which is 3 centimeter below the hymen. So the point A can range from -3 to +3, according to the level of the descent or the degree of the descent. So it is a fixed point, so it starts from -3 till +3. It can be at any point of these parts, okay, according to the descent. Okay, so that is the range of A point. It can range from -3 to +3, but it's normally present at -3 level. Okay, is it clear? And the same will be for A on the posterior wall or A posterior. Okay, so let's see what's point B. So I'll draw again the uterus and the vagina, and here our reference point, which is the hymen at 0 level. Okay, so we graded the vaginal wall B4 to be like that: 1, 2, 3, 4, 5, and 6. Okay, and we told that point A is located at -3 level, right? And we told that it is normally placed 3 centimeter proximal to the hymen. 3 centimeter proximal to the hymen. So what's point B? If you need to know about point B, we need to see what is the remaining upper vaginal wall. So this is the remaining part of the upper vaginal wall, right? So where is the most distal point of that part? So the most distal point of that part should be here, right? So normally point B will be at -3 as well. Okay, because point B is the most distal point of the remaining upper vaginal wall, is either anterior or posterior vaginal wall. So if we look at the posterior vaginal wall, this is -3 level, and this part is the remaining upper vaginal wall. So where is the most distal point? Here. That is the most distal point. So it's distal to the patient. That means the nearer to the outside. So the most distal point of the upper vaginal wall. That means also it will be at -3. The difference between point A and point B is that point A is a fixed point, but point B is a changing point. So if we have a descent from any of the vaginal wall, the point B will move to be the most distal point of the prolapse. Okay, so it can go down. Like if we have a complete procedentia or total vaginal wall prolapse down, so the leading point of the prolapse will be point B. So it can range from -3, which is this level, till total vaginal length. So that's the difference between point A and point B. Point B is the most distal point of the prolapse, but it is normally present at -3 level. If there is no descent, no prolapse, it is normally placed at -3. But if there is any prolapse, it is the most distal point of the prolapse, or the leading point of the prolapse. Okay? So that's point A and point B. And we have agreed that we have A anterior, B anterior, A posterior, B posterior, and all the 4 points are normally placed at the level of -3. Point A ranges from -3 to +3. However, point B ranges from -3 till the total vaginal length. Okay, that is the range where these points can move. Okay, so we have discussed point A and point D. What point A and B, sorry. So what about point C and point D? So let's draw again the uterus, the vagina, so point C. C stands for cervix or vaginal cuff. Okay, so cervix if the woman has a uterus. vaginal cuff if she had a hysterectomy before. So it's mainly at this level, okay, which can be total vaginal length or total vaginal length minus 2. We assume that sometimes the ladies normally may have their cervix like 2 centimeter inside the vagina, like sometimes maybe, sorry, like that. So like 2 centimeters inside the vagina. So the C point may sometimes become here. So it will be 2 centimeter less than the total vaginal length. So if we have, for example, the total vaginal length is 8 centimeter, so C point can be either the same level at the total vaginal length, which is here, or total vaginal length minus 2, which is 6 centimeter. Okay, so C stands for either cervix or vaginal cuff, depending whether the woman has a uterus or no. So what about point D? So let's draw again. So point D, if you want to remember it, it refers to the Douglas pouch here. So it's the upper point of the posterior vaginal fornix, or the posterior fornix of the vagina. Okay, so here is the Douglas pouch, and that's the upper part of the posterior vaginal fornix, and that's where point D is there. If the woman had a hysterectomy, point D will not be there, because there will not be Douglas pouch, because the uterus is already removed. Okay, so that's point D. So these are the 4 points inside the vagina. Let's revise that again. So first of all, we need to know our reference, which is the hymen at 0 level. Okay, and then on the anterior wall we have got point A anterior at the level of minus 3, and at the same time and at the same place we have got B anterior, which is at the level of minus 3. Okay, and on the posterior wall we have got A posterior, which is at the level of minus 3, and again B posterior, which is at the level of minus 3 as well. Okay, and we have 2 points, which is C point, which is the lower edge of the cervix or vaginal cuff, and we have got D point, which is the upper part of the posterior vaginal fornix, and this point is not applicable if the patient is having hysterectomy. Okay, so to summarize everything, we need to draw a 9 squared grid like that. If we need information about where are these points located, so that we can know which prolapse the patient is having. Okay, so we'll start with the upper row with A, B, C. The lower one will be A, B, D, and then the middle row, we will fill it like that: genital hiatus, perineal body, and total vaginal length. So these are distances. So the genital hiatus, which is starting from the middle of external urethral meatus to the posterior margin of the hymen. Okay? So roughly it can measure normally like 3.5 centimeter. Okay? The perineal body, which started from the posterior margin of the hymen till the middle of the anal opening, and that can be up to 4 centimeter normally, and total vaginal length mostly is 8 centimeter. It's actually, these measures are not fixed in every woman, but we can take the average numbers. Okay, so that's the total vaginal length, and that's the perineal body, and that's the genital hiatus. So the upper row will show us the points on the anterior vaginal wall, so we will add A and A, and the lower one will show us the points on the posterior vaginal wall, so we'll add P and P. Okay, so if I say, for example, that this lady has got point A anterior lying on +1, so let's translate what I'm saying. So that is on +1 level, and B anterior lies on, for example, 0 level, and point C is lying at 6 centimeter. Point A posterior is on -3, BB is on -3, and D is at 8 centimeter. So how can we interpret that? So A anterior usually lies at -3, that's normally. So when it comes down to +1, that means we are now crossing the hymen, so we have a descent, and that descent from the anterior wall, and that's why point B also moved down. Okay, and then the cervix is at the same place of its original position, which is total vaginal length -2, so there is no cervical descent, it's only anterior wall descent. And actually, in most of the cases, you will find point A lower than point A. Is not evident here. Like we can see point B is at +2, for example, because it is the leading edge of the prolapse. So it should be lower than point A. Okay, so that's anterior vaginal wall descent. Let's have a look on the posterior vaginal wall. No, all the points now are on their normal position, so there is no posterior wall, no posterior vaginal wall prolapse, no cervical descent or uterine descent, but we have an anterior vaginal wall descent, or we call it cystocele. Sometimes it may be urethrocoele, but this quantification system will not tell us what is the type of prolapse. It just tell us whether this is the anterior wall, this is the posterior wall, or this is a cervical or uterine descent. Okay, so if you put all the points like that, and then put the numbers given to you, if there is any numbers, and then you interpret whether there is any anterior wall descent, any posterior wall descent, any cervical descent, then you can know what type of prolapse the patient is having. Okay, so now we know that this patient is having anterior vaginal wall prolapse, but we don't know actually what is the stage of her prolapse. So we need to know about the staging. So how many stages we have? We have 4 stages. Okay, so stage 0 is considered is not considered one of these 4 stages. Stage 0, when every point in its normal place, there is no prolapse. Okay, so that's the stage 0, where everything is in its normal place, there is no prolapse. We need to know what is stage 1, what is stage 2, stage 3, and stage 4. Okay, so I just want you to remember one thing. If the leading point of prolapse coming between -1 to +1 from the hymen, that means we are in stage 2. Okay, you know that point A and point B normally on -3. So if it came down between -1 to +1, that means we are in a stage 2 of the prolapse. So what about stage 1? Stage 1 will be above -1. And like, you know, if point A at -3, if it descends like to -2, that's a stage 1. But if it descends more than -1, that's a stage 2. Okay? So anything which is more than 1 centimeter above the hymen, that's 1 centimeter above the hymen, will be considered as a stage 1. So again, I know it's totally confusing. So let's have the staging again. So we told that stage 0, when there is no prolapse. Okay? Then stage 1, when the distal part of the prolapse is above the hymen by more than 1 centimeter. So it's more than 1 centimeter above the hymen. 1 centimeter above the hymen means that is -1 level. So anything more than that or above that level is considered as a stage 1. Stage 2 will be when the leading edge of the prolapse between -1 to +1. So anything which is less than centimeter above the hymen to anything which is more than 1 centimeter below the hymen. Okay, so from 1 centimeter above to 1 centimeter below is considered as a stage 2. What about stage 3? So we'll start from stage 2. It ends at a +1. So we'll start here from more than +1, but less than the total vaginal length. Which is -2, like this, the cervix level. So we assume that, yeah, the prolapse is going further down, but we don't have complete vaginal wall prolapse. So it is more than +1, but it is still less than the total vaginal length -2, which is the normal level of the cervix. Okay? And then stage 4, which is complete vaginal wall prolapse. Complete vaginal wall prolapse, that means the leading edge of the prolapse is more than total vaginal length -2. Okay, so again, stage 0, there is no prolapse. Stage 1, when we have the leading edge of the prolapse lies more than 1 centimeter above the level of the hymen. Stage 2, when it is 1 centimeter above the hymen or till 1 centimeter below the hymen. Stage 3, if it is more than 1 centimeter below the hymen but still less than the total vaginal length minus 2, and stage 4 is more than the total vaginal length minus 2, which is complete procedentia or complete vaginal wall prolapse. Okay, I know it's too much confusing, but it's really, really important. It can come as a teaching station. All of us know how to conduct a teaching station. So you can go through the same frame of any teaching station. You introduce yourself by name and role for your colleague, welcome him to the department. Don't forget to ask about bullying, and if he needs any support or anything, ask him why he wants to know about this POPQ, and then you start to put the agenda, offer questions, and by the end you can also give him some links from strategy, and also if he needs any help in that topic, he can come back and ask you, give him your contact details and everything. Sometimes it may be as a part of a structured viva, when you discuss with the examiner about the prolapse, and sometimes he may ask you, how do you assess the patient? So when you tell, I take the history and I examine the patient, and if he asks you about the examination finding, you can just tell, like, we will examine like vaginally and assess her from the point of POPQ system, if it is applicable, and then they may start with you to ask about what's POPQ and what are the points and what are the normal levels of these points. Okay, so I hope you can understand my explanation. I tried to make it simple, but you know, don't feel bad, because this topic is really, really difficult, and it needs some orientation and repetition again. Thank you, and if you have any queries, just send me and I will be of help. Thank you.